Today I want to demonstrate a physical assessment on a preschool child. Clarence is here as a 5-year-old kindergarten student for his physical assessment. Hi, Clarence.
Hi.
The first part of the physical exam is really an assessment of his skin. Clarence, I need you to take your shirt off so I can see more of your skin. Gaining cooperation from a child at this age, to give simple commands are really telling them exactly what it is you want them to do rather than to ask them to do something. You notice I said, Clarence, I need you to take off your shirt. I can also assess while he's doing this some of his fine motor skills. He's able to button, or at least to unbutton his shirt to get it off. I can inspect his skin and see that it's smooth, it's consistent in color, it's moist in the palms, no visible scarring, color appropriate for a child his race, lighter in the palms. Fingernails are also a part of the physical assessment of the skin, and you can see that his nails are contoured appropriately, well adhered at the nail bed, cut nice and short. Hair is included in the assessment as well. He has hair consistent with his racial expectations. Distribution is even, though cut very short in a quite stylish new haircut. I want to inspect Clarence's skull. I want to feel for any lumps or bumps, making sure that the contour is smooth. There's no depressed areas. It's very much nice and smooth. His neck. I identify the sternocleidomastoid muscle as I see it here to see if the trachea is midline. Trachea is midline. I can palpate with 2 fingers. Sometimes it's actually easier to do it from the back. I can palpate the landmarks. Turn your head to this side, please. Back toward me. Look toward me, Clarence. Swallow. In swallowing, sometimes the actual soft tissue of the thyroid can be felt moving smoothly down under the fingers. The lymph nodes are a very important assessment in a child this age. And I palpate in front of the tragus, the external ear, for the preauricular nodes. And to use both hands and palpate bilaterally simultaneously allows for comparison of node size if there is any node development. Behind the ears, I palpate for the posterior auricular nodes, which would be just above are on top of the mastoid area. At the corner, the angle of the mandible, the tonsillar nodes can be palpated. Halfway between the angle of the mandible and the chin, the point of the chin, I palpate for the submaxillary nodes. At the tip of the chin and midline, the submental nodes can be palpated. Behind the ear, I again want to palpate for the anterior cervical nodes, which run superficial to the sternocleidomastoid, palpating behind that toward the trapezius, the margin of the trapezius muscle, where I can palpate the posterior cervical nodes. And then midway between the mastoid and the protuberance of the occipital area, I palpate for the occipital nodes. In all of these areas, particularly in anterior cervical region, many children Clarence's age will have palpable nodes. Those nodes can be palpable up to the size of 1 centimeter, as long as they are non-tender, non-erythematous, well-defined margins, mobile. In this age child, that would be considered normal. The only other area where we palpate for nodes is here. Supraclavicular node is where the sternocleidomastoid attaches to the clavicle. Any node of any size palpated in that region would be considered abnormal. To assess the eye, the first assessment would be the visual acuity. In a child who's 5 years of age, 20/30 or 20/40 would be considered normal visual acuity. In addition to that, we would also like to have some information about his peripheral field function. And what I would do is stand in front of Clarence, separated by 2 feet. I need to keep my hands at his eye level and ask you to tell me when you can see the you have to look at me. You see the fingers wiggling? Okay, good. Extraocular function is an important part of the assessment of this child. The corneal light reflex, if I shine the light held about 9 inches in front of Clarence, I look to see if the light's reflected in the same place in each eye. This helps to evaluate whether or not the muscle balance is appropriate. I also want to know if he can follow the 6 cardinal fields of gaze. Clarence, I want you to look at the light. Good job. Lateral. Great. And then as it comes to your nose, super. Pupillary response can be seen by directly shining the light into the eye. And then as the light comes to his nose, once more, his pupils constrict. A cover test is another way of evaluating his muscle balance. I can shine a light in his eye and observe whether or not the eye that's uncovered has to search for the light if it moves when I cover this eye. Clarence, watch the light. Good. And when I uncover the eye, to observe whether or not this eye shifts when it's uncovered. Let's do it with this eye. No. Looks good. We've spoken earlier about his eyebrows, his eyelashes, lashes being a part of the eye exam. To push slightly the corner of the eye, you can see the lacrimal duct. Bilaterally, without any discharge. The sclera is clear. The iris are round. The eyelids, look up, Clarence. The upper lid is at the margin of the iris, look down. And the lower lid is also at the margin of the iris. To examine internal functions of the eye, small children we can do, and even on clearance, we can get a red reflex to examine the left eye to my left hand and to my left eye. Clarence, you need to look that direction, please. Look right there. Again, entering the side, I can actually find the disc to be pale yellow. Round. Keep looking that same place, Clarence. The vasculature, again, is readily identifiable. Very good. Sometimes that's hard to do. We were able to see a red reflex, and often in small children, a red reflex can be the screening that you can do. It allows you, the red reflex allows you to know that the light is actually reflecting off the back of the eye and that there's nothing clouding the passage of that light to the back of the eye. So it's a way of ruling out cataracts. We can assess his ears as the next part of his physical assessment, and by looking at his head, I would assess the external structures to be the tip of his penna is parallel with the corner of his eye, and his ears are symmetrical. They have a slight rotation of about 10 degrees. Nice and flat against his head. And with an otoscope, and a pneumatic bulb, I will pull down and out in a child this age in an attempt to straighten the external canal. I will gently place the speculum in the external canal, and I see the canal is pink with a minimal amount of cerumen, and the cerumen is moist and brownish. I can see the landmarks of the TM. I can see the umbo, the malleus, the light reflex, which is reflecting off of the pars tensa. I can see the pars flaccida. The TM itself is pearly gray, and with an introduction of a small amount of air with the pneumatic bulb, I see that the TM moves very well. I would examine his other ear. Doing great. Again, noting all the landmarks, the appearance of the external canal, evaluating the cerumen that is present, and testing for mobility of the tympanic membrane. Good job. Auditory function in these children can also be assessed by pure tone audiometry, and that is a very important test as children start into school. I'm going to look the internal structures. I can see that the septum is only slightly deviated. It's, for the most part,